name is Jessica Dixon. I'm a nursing student here at South, and I'll be doing the catheter insertion check-off. So the first thing I'm going to do is I'm going to verify the order in the hospital policy. So once I do that, I'm going to perform hand hygiene. Then I'm going to identify my patient using two identifiers. So Jaguar J. Jones, 8/25/1963, 8/25/1963, allergic to penicillin, and penicillin is also on the wristband. So once I do that, I'm going to explain the procedure to the patient, and then I'm going to say three indications for an indwelling catheter. So one would be required immobilization for surgery, trauma, or other therapies. Another would be acute ventilator-dependent respiratory failure, and another would be acute worsening of mental status. So once that is done, I want to gather my equipment. I have it gathered here today. So now I would want to don my goggles, and then I want to position the trash can and perform hand hygiene. So now I'd want to raise the bed to a working height, lower the side rail, and position my patient in a dorsal recumbent position with the legs slightly bent. So now I would want to put on clean gloves, and I would want to do perineal care. So I would want to do this with soap and water, clean the inner thighs. For a female, I would want to spread the vagina. I would clean the outer labia, dispose, inner labia, dispose, and in the middle and dispose, and I would be working my way from top to bottom. For a male, I would start at the tip of the penis, and I would do a circular motion, discard, and then do circular motion, discard, all the way down to the shaft. So after that is done, I want to remove my catheter kit. I'm going to place it in between the patient's legs, and I'm going to place this here as a trash bag. So now I'm going to want to open it, starting away from me, and then lastly towards me. So now I want to don my sterile gloves. So I just want to make it clear that I will be working at a height that is above my waist, because this is a sterile procedure. So I would make sure that whatever I was working on was above my waist. Same thing as applying these, donning these sterile gloves need to be above my waist. Oops. So the next thing I want to do is I want to lay my sterile drape down. So I'm going to take it out, and I want the shiny side on the bottom. So once that is down, I want to avoid the 1-inch border, and so now I'm going to place my tray closer to the patient. I'm going to get my cleaning, my supplies. So what I want to do is I want to open the swabs, the betadine swabs. Place those on my kit. So then I would want to get the lubricant and put that on the outside. Then I want to remove the cap from my water-filled syringe, and I would want to connect it to the balloon port. Once that is done, I would remove the plastic. And then dispose of that. So now I would lubricate. For a female, I would do the first 1 to 2 inches. For a male, I would do 5 to 7 inches. So I'm going to place that in my lubricant. And now I want to position and prepare the patient for cleansing. So for a female, I want to clean the urethra for both female and male. So for the female, I want to open the vagina. This hand is now contaminated, so I'm going to leave it on the skin. So I'm going to wipe the outer labia and then dispose of that. I'm going to wipe the inner labia, dispose of that, and then I'm going to wipe the middle and dispose of that. So for a male, I'm going to then dispose of these. So for a male, I would want to start at the tip of the penis and with a circular motion with a swab and dispose of that, and do it again with a new swab each time until the urethra is clean. So the next thing I want to do is I want to inform my patient that I'm about to put the catheter in, so they can bear down as if voiding, or they can take a deep breath in, exhale, and hold it during insertion. So now I'm going to grab my catheter in my dominant hand. I'm just going to move my box closer to my patient, and I'm going to insert the catheter. So I'm going to do this until urine is returned. Once it is returned, I will stick it 1 to 2 more inches. This is for a female, and for a male, I would stick it all the way to the bifurcation. So once that is done, I'm going to grab the catheter with my non-dominant hand. I'm going to grab the plunger with my dominant hand, and I'm going to push the water into the balloon. When I'm doing this, I'm going to make sure that I do not, that I never stop applying pressure on the plunger. So once that is done, I'm going to remove the plunger. I will dispose of this, but today I'm not going to do that, so I'm going to remain above my waist for that. Just make sure that I remain above the waist, but I have to use that for the next procedure. I meant for the next part of the procedure. So now after I do that, I would want to tug on the catheter and then slightly advance just to avoid tension. So the next thing I want to do is I want to now put the stat lock on. So what I would do for this is I would open the container of the stat lock, I would dispose of that, and then for this I would open the clip, put the bifurcation in there, and then snap, and then I would need to use, I actually threw the alcohol pad down there, or the cleansing pad down there, but I would need to prep the skin before I stuck this on there, and then once I prep the skin, this needs to be a little bit further out. I would need to put it onto the thigh just like this, and make sure that there is a little bit of slack on here so that there's no tension and it does not cause it to pull. So once that is done, I would like to show how to remove it. So you would unclamp, and then once it is unclamped, remove that. To remove this, I would need to use some alcohol to remove it from the thigh. So that's how I would get it off. So then now what I need to do is I would need to put the bag, the drainage bag, attach it to the bed frame. I would put it below the patient's bladder, and I would avoid putting it on the side, the bed rail. So once I did that, I would make sure that I clip this to the patient's sheets, and then I would have that there. So now for the urine collection, for a drainage urine collection, the drainage bag urine collection, what I would do is I would need a graduated cylinder. I would put this down here. I would open the cap, and I would place this on a sterile table, just to clarify that. And then I would need to come down here. I would need to disconnect, making sure I don't touch the tip of this container with anything else, so just need to be careful of that. I would need to open this up, and then I would need to make sure that it was over the cylinder, and then I'll place this under. So I would make sure that I don't contaminate the top of the container again. So I would unclamp, and then once I was done, I would reclamp, and then I would make sure to reconnect the part, and then I would need to put the cap back on, label it, and send it to the lab. So I would do this kind of urine collection when the catheter has just been placed. So for a catheter that has been in for hours or days, I would want to do a port collection. So for a port collection, what we're going to do is we're going to clamp the tubing first. So unclamp it from the patient's bed, and then we're going to clamp. So now we're going to want to clean the port. So according to hospital policy, I would clean it however they wanted me to do it, and then I would dispose of that. The next thing that I would want to do is I would want to make sure that this does not come in contact with any other skin after it has been cleaned. So this would be a luer lock syringe, but I do not have one of those today. So I'm going to use this regular 10 milliliter syringe. I would insert it, and then for a luer lock, I would twist to secure. Now I would withdraw urine. I'm sorry, and then I would go ahead, I would already have my my collection cup open with the cap facing up. So once that was done, I would remove, and then I would make sure I don't contaminate the top of the container. I would insert the urine, dispose of this, but for now I'm not disposing because I'm using it for other parts. Label it, and then send it off to the lab. So now I would need to unclip the tubing and clip it back to the patient's bed. And then I'm going to get all my supplies, and I'm going to dispose of those in a trash can. So I'm going to remove my sterile gloves, so glove to glove, and then skin to skin. And then I would need to, after I remove my gloves, I need to perform hand hygiene, lower the bed, raise a side rail. I would also dispose of this as well. Raise a side rail, make sure that the coli is available for the patient, and then I would make sure that the patient was comfortable. So then I would need to perform hand hygiene, and then do documentation. So what I would document is I would document the size of the catheter, I would document the amount, the color, the consistency of the urine, the specimen collection if appropriate, and how the patient handled the procedure. I would also need to perform daily catheter care. So I would do this with soap and water, and then after incontinence of stools. So then I would also need to remove the catheter as soon as indicated, as soon as medically indicated. So to remove the catheter, what I want to do is I would come back in the room, identify the patient and everything. Once that is done, I'm going to make sure that I have my goggles on. I'm going to make sure that I have my gloves on. And then I'm going to use a graduated cylinder to measure the urine in the drainage bag. So I would collect it all in the graduated cylinder and then measure. So once that was done, I would want to get a 10 milliliter syringe. I would want to pump it a little bit, push and pull to loosen, and then I would want to withdraw 0.5 milliliters. And then I want to collect it to the balloon port. So I would, okay, before I do this actually, I would actually lay a waterproof pad down. So once my pad is down, then I would want to grab the cylinder, pump, and then pull back 0.5. So I've already done that. So I would connect it to the balloon port, and allow gravity to withdraw the water. Okay, I'm not really sure what's happening here, so I'm just going to help it go back. Okay, there we go. It is moving again. So once we get all of that water back into the syringe, I'm going to remove it, and then I would dispose of that, and then I'm going to remove the catheter, and then dispose of the catheter and unclip from the patient's thing. So now I would perform hand hygiene, and then I would want to do perinatal care, and then perform hand hygiene, and now I'll do documentation. So for documentation, I would want to document the amount, color, consistency, and odor of the urine. I would want to document the intactness of the catheter tip, as well as how much water came out of the balloon. And then also I would want to document the patient's tolerance of the procedure, as well as the patient teaching of symptoms of a UTI. So symptoms would be frequent urination, frequent small amounts, burning while urinating, blood in the urine or cloudy urine. And then I would plan to assess my patient for voiding in 4 to 6 hours, and if voiding still has not occurred, I would want to palpate the bladder or obtain a bladder scan. And this concludes my catheter check-off.